Good afternoon. I had the good fortune of listening to the previous lecture. It was truly inspirational. I almost feel like starting my journey of life again. But I've gone through a major part of it, and since such fabulous advice was given to you just a few minutes ago, I don't think I need to repeat some of those wonderful advice. So what I'm going to do today is really take you through another kind of a journey, not my personal one, but the journey of assisted reproductive technologies, which really came from an out-of-reach treatment to today a mainstream modality. The journey of 1,000 miles begins with one step. All of us are aware of it. And in the field of assisted reproductive technologies, that first step was taken way back in 1978 when Sir Robert Edwards and Steptoe created and delivered the first test tube or IVF baby in the world, Lucy Brown. So way back in 1978, Lucy Brown was born in Greater Manchester. With her, this is Lucy Brown, who later went on to have her own baby, naturally. She had her own baby, and this is she with her son, with her mother, who was the first lady to actually become pregnant with IVF, and Sir Edwards. So the birth of Lucy Brown, that is the first test tube baby in the world, was obviously celebrated all over the world by scientists as an amazing achievement. All the couples who could never become parents were absolutely excited that finally there was some solution to their problems and that they might be able to become parents in the future. But as always, there was huge amounts of criticism. There were creationists, the religious heads, who said that you are not supposed to tamper with nature. How can you touch nature who's supposed to create babies, and you're actually trying to create babies in a test tube? And there's a huge furor, and the entire religious community went against the couple who decided to have this first IVF baby. But religious or otherwise, by the next few years, hundreds and thousands of IVF or in vitro fertilization babies were born. Today, more than 5 million babies have been born worldwide with the help of infertility specialized treatments such as IVF. The number of babies born by assisted reproductive technology today is almost more than the population of many countries such as Ireland or Lebanon. I had the privilege of being with Sir Edwards, who was of course knighted, and which is why he's Sir Edwards. This is me many years ago with him. And of course, I had the privilege of working with Dr. Indira Hinduja, who is the first lady credited with being the first IVF doctor who made IVF in India. And of course, there was controversy. Dr. Indira Hinduja is acclaimed as the first doctor to have done IVF in India, had a baby, but there was a baby born in Kolkata called Durga, who was, it was claimed, was born just 67 days after the first IVF baby in the world. And this doctor, Subhash Mukhopadhyay, who actually appears to be the first man or first doctor to have done IVF, was never given that credit. And in fact, inquiries were put against him, and eventually, out of sheer frustration, he committed suicide because he was never acknowledged as the father of IVF in India. And so many of our fields, there's a lot of frustration. There's not just success and achievement. So getting into the actual process, how do we actually initiate the process of IVF? The first thing is, of course, to evaluate the patients who are undergoing IVF. So first thing is always check the uterus. The uterus has to be perfect. If inside the uterus, you can see here, there are some polyps, and you can see this. So with hysteroscopy, we're actually removing out the polyps. And of course, if there is something like tubal hydrosalpinx, the fluid is filled up in the tubes. You can see here this thick blue thing. This is fluid filled up in the tubes. That's a hydrosalpinx. All of this has to be treated prior to doing the IVF. So even if the woman's tubes are removed, there is no problem. She can conceive through IVF. But it's important to create a good environment, especially the inside of the uterus, so that when we actually implant an embryo there, it actually takes and gets implanted. So pre-IVF or pre-ART hysteroscopy, which is actually putting a very fine, thin camera into the uterine cavity through the vagina, is very, very important. Not only can we take care of all problems like small polyps or fibroids or some adhesions inside or treat some infection, but we can also, just the process of doing a hysteroscopy or doing some invasive procedure into the uterus actually improves the implantation rates in the next cycle. So you can see this is many, many polyps inside the uterine cavity which are being actually shaved out or treated, and little pieces are being made and it's been removed. Semen analysis obviously is extremely important on the other side, and we always do a standard semen analysis of the husband, do a culture if there's an infection, and especially smokers and people who are undergoing a lot of stress, we can actually see DNA fragmentation and we can do that test now. The IVF procedure for all of you is a very simple and a standardized procedure today. What do we actually do? We give the lady medicines, injections, gonadotropins to produce a number of eggs, because normally only one egg is produced, but we like to have a number of eggs. So injections are given for an average of about 10 to 11 days. Number of eggs are produced. Then we monitor that through sonography to make sure the eggs are ready. Once that is ready, a transvaginal sonography is done, the eggs are visualized and they're actually just removed transvaginally through a small needle. Once the eggs are removed, they are immediately transferred into the lab which lies next door, and the eggs are dissected out. They are mixed with the sperms in a dish, in a petri dish. We allow them to fertilize overnight, allow them to grow for 1 or 2 days, and once these embryos are ready, they're picked up and within a minute or a half a minute actually put back into the uterus of the lady with a very, very tiny catheter. So it's a standardized procedure today. The injections, there are many different protocols, we don't need to go into that. Earlier on, the injections used to go on for many, many days. Now what we do is the antagonist protocol, whereby the injections have reduced a lot. So typically injections are started from the period, second day of the period, go on for about 10 days. Sonography is done on 2 or 3 occasions during the injection procedure, and by around 11 to 12 days or 13 days, the eggs are ready to be removed. The entire procedure of IVF started from the period, gets over by 15th or 16th day of the period. Nowadays, very minimal stimulation protocols are also given. So the cost has come down, just tablets are given, no injections are given, or minimal injections are given, and so the treatment has become cheaper and much easier on the patients. So you can actually see this is how we are monitoring the follicle. This is a transvaginal sonography. The transvaginal probe is very narrow. It is put into the vagina and the ultrasound is done. And you can see the number of eggs. These are all little eggs that are growing inside the ovary, and you can actually see these eggs developing, and this is how we monitor the follicles. Then this is the actual procedure of the egg removal. So the sonography probe is inside the vagina, and you're actually seeing this, and you can see a needle actually going inside the, you can see this is the pointer's going here, right? So this is the needle, and now these are the eggs which have been retrieved, and you can see them under the microscope. So within about 10 minutes, the eggs are retrieved. The entire process of egg retrieval is a short general anesthesia of 10 to 15 minutes. After that, the laboratory does the work. The embryos are cultured in the laboratory in an incubator, and 2 days or 3 days later, these embryos are taken out and with a very fine catheter put into the uterus. It's a simple procedure, but a very highly skilled or very specialized procedure. And this is the embryos being transferred back into the uterine cavity. So this was your standard IVF procedure. And then, from 1970, every year there were some amazing new great introductions, great new discoveries being made. As it is in IVF, as you can see, the number of eggs that are produced is to have many embryos, and we could only put back 2 or 3 embryos, and all the others would go waste. And that was very, very precious human life, embryos, growing embryos that were going waste. And so, way back in 1983, Alan Trouson, for the first time, brought about this new technique called freezing of the embryos. And it was a first, it was amazing. He could put back whatever embryos he wanted, and all the extra embryos were actually frozen into liquid nitrogen. And of course, as luck would have it, his pregnancy, the first pregnancy got frozen embryos, the lady aborted at 24 weeks. So you can imagine the frustrations that one goes through. You're the first in the world to do this technique. Embryos there, baby's growing, first frozen embryo, baby growing, and then she just starts leaking and aborts her baby and takes away the credit from this man of being the first person to have a baby born through embryo freezing. Couple of years later, the first time eggs were frozen. It has always been easier to freeze a ready-made embryo, a baby, but eggs were very difficult to freeze. And so it took many, many years later when Dr. Christopher Chen of Australia actually just took out the eggs from the lady and froze them directly. In situations where you're not married, or you're planning to have babies much, much later, you're not sure you're going to find the right man, egg freezing was huge. And so the first egg was frozen way back in 1986, and today thousands and lakhs of eggs remain frozen in IVF labs across the world. The journey of IVF continued, and many, many amazing achievements happened as we went along. In 1985, the first baby was born from what we call blastocyst culture. Blastocyst is actually growing an embryo for 5 days in the laboratory. That's the maximum that has been allowed officially, that 5 days you keep the embryo in the lab. It's really developed to a good stage, and that embryo, when it is taken and put back, the pregnancy rates are fantastic, significantly improved. And that happened in 1985. All this time, the eggs were removed by laparoscopy. You had to actually enter into the abdomen, make a cut, introduce a laparoscope, and remove the eggs. So by ultrasound, the first egg removal was done way back in 1985. Then, something very amazing if you consider the intricacy that is involved. In 1989, pre-implantation genetic diagnosis was introduced. What is this? The embryo, which is so small, microscopic, you can't even see it under a normal microscope. That embryo was actually biopsied. So what was done? The zona, the hard cover, like the shell of the egg, was actually cut open. Then a biopsy was taken. One of those cells, so normally an embryo may have 4, 6, 8 cells. 1 or 2 of those cells was removed of the embryo, which is so microscopic, and then that was analyzed to see if it had any genetic defect. And only the normal embryos then were put back. So for women who had multiple abortions, who had patients who had a baby with a previous abnormality, this was a magical treatment. So all carriers of sex-linked disease, single gene disorders, chromosomal problems, older ladies who were at very high risk for Down syndrome, all of these patients really benefited by this fantastic technique. And of course you can see very briefly how it's done. You can see the embryo is actually being held by a pipette, couple of cells are there. And then we do a laser hatching, so we cut off the shell, and this probe is actually going inside, very gently retrieving 1 or 2 of the cells from the embryo and actually then analyzing it. I don't know if you can see the very tiny movement. You can't be rough because it's such a delicate embryo. And then this cell was actually analyzed, and nowadays within about 24 to 48 hours you can actually do the entire genetic analysis of that 1 cell of the embryo, and you can tell the patient that her embryo is normal or abnormal and actually transplant back only the normal embryos. And this today is quite a routine procedure. Then assisted hatching. I told you how to cut open the embryo. The zona is hard like an eggshell, and so laser hatching was introduced. And you can see it's like a target practice. When we first got the laser, we were the first ones to get it in India. It was like target practice. It was so much fun. You could just go there and literally shoot and cut open the zona and actually enter into the embryo where you could actually retrieve the blastomeres. And this laser is so fine, it's much, much finer than even your ophthalmic lasers which you do a LASIK with. So very, very delicate stuff, because the human embryo or human life is being touched over here. Then came in a new technique called in vitro maturation. Because to create eggs to mature, I told you just now, you need to give 10 to 11 days of injections. And patient takes a lot of time, she has to take a lot of hormones, there's a lot of hormonal imbalance in her body. And so this was all tried to be bypassed by doing in vitro maturation. So what happens in vitro maturation? You remove immature eggs, whatever normal ovary has, just give 1 or 2 days of injections, and within 3-4 days take out the immature eggs. So you don't even wait for the eggs to grow, pick them up when they're tiny and actually mature them in the laboratory. This was an extremely difficult technique, and as a result, even today, it hasn't become commonplace. Some labs are doing it, but it's pretty difficult. But the technique was amazing to take out immature eggs and to grow them. Despite so much progress, there were still shortcomings of IVF. Because in IVF, the eggs and the sperms were put in a dish and they were supposed to fertilize themselves. And sometimes it did not happen. There was just fertilization failure. Men who had a very poor sperm count could not benefit by this technique. So, as you know, progress is impossible without change. Those who can't change their minds can't change anything. And so, minds needed to be changed. And this new technique called intracytoplasmic sperm injection by this young man called Palermo actually brought about a drastic change. You can see what he did. He actually picked up a sperm and physically injected it into the egg. And you can see the pipette with the sperm exactly moving, going into the egg. So rather than letting them do their own job of fertilization, we actually picked up the sperm and physically injected it into the egg with a pipette, and intracytoplasmic sperm injection was born. And this became a huge breakthrough. So much so that today in our lab, almost 100% of cycles are done by ICSI. We don't leave anything to chance. We pick up the sperm and we actually physically fertilize all the eggs ourselves. It started with a treatment only for men with very poor sperm count. But today, ICSI has become a treatment almost for everybody. So any problem, a man, for example, who's paraplegic, man with impotence, a man who has almost no sperm count or even zero sperm count, we can actually take the sperms and inject them into the egg and achieve a pregnancy. So this was an amazing breakthrough. And then, like I said, men with zero sperm count. Zero sperm count because either the epididymis was blocked, they were born without bilateral absence of the vas, so they were born without a vas, or they actually went into testicular failure because of mumps in childhood or any such problem. And so we have many, many techniques. We have percutaneous epididymal sperm retrieval, we have testicular aspiration, testicular biopsy, micropisa, many techniques by which with very minimal invasion, very, very tiny needle, we can actually retrieve sperms directly from the epididymis or from the testes. Of course, very few sperms are achieved, but those few sperms are picked up then with a pipette and injected into the egg, and you can achieve a pregnancy. So imagine men who have given up on the idea of ever becoming a father because they have zero sperm count. They are actually fathering children on a regular basis. Men in testicular failure, abnormal hormones, FSH is high, they are able to give some sperms on macrotisa and actually become fathers. So I have often given a talk called No Male is Infertile. So that is how much technology has now progressed. The journey of IVF continued with great breakthroughs every single year. In 1993, like I said, this ICSI, the testicular biopsy, was done, and in vitro maturation baby was born. This is one of my favorite quotes, that if you always do what you've always done, you'll always get what you've always got. If you want more, and I'm sure all of us want more, you have to do something which has not been done before, either by you or by the others. And so Katayama, a Japanese, very, very progressive scientist, did what is called vitrification. All these years, embryos were frozen, and we also had these very expensive machines running between 25 lakhs, 30 lakhs. The freezing of the eggs or the embryos used to take hours. Overnight, a team had to sit down and freeze the embryos. And the success rate, pathetic. If we froze 10 embryos, we would lose almost half of them. And at the end of the day, when we would actually want them, we would take them out and thaw them. Our pregnancy rate was this low. And so, what he did was he introduced a new rapid freezing technique. No fancy machines, nothing, just simple liquid nitrogen which costs almost nothing. And a very quick technique, just a couple of minutes. And he did this technique for freezing embryos called vitrification. What did he get? 100% saving of embryos. Not a single embryo was damaged or destroyed. And pregnancy rates jumped to almost 50%. Soon after this discovery was made, my husband and me went to Tokyo. We lived there for a period of time. We learned this vitrification. And believe me, it literally changed the way that our lab works. Because now we have hundreds of these are cryo cans, cryopreservation cans in which liquid nitrogen is filled up. And we have hundreds of such cans filled with thousands and thousands of eggs, embryos, and sperm. And this vitrification technique has given us so much confidence that today we can say that if you want to take out your eggs at a young age, for whatever might be a reason, we will freeze it for you. And whenever you want to have a baby 10, 20 years later, we will take out your eggs, we'll fertilize it with a partner's sperm, and we will give you a baby. That's the kind of confidence this technique has given us. And one of our great spokesperson for this was Miss World, Diana Hayden, who actually talks about it openly, and which is the only reason why her picture is put here, because she froze her eggs with us when soon after she was Miss World, many, many years ago, because she didn't have a partner, she wanted to pursue her career, and she froze the eggs with us. And many years later, in fact, just about 3 years later, she got married to this handsome young man, and she came back. We did ICSI for her, and she has this beautiful baby from eggs which were frozen. She was a very young lady soon after she became Miss World. Then came in another breakthrough called IMSI. Again, we were the first ones to bring IMSI into this country. It's intracytoplasmic, morphologically selected sperm injection. And what we do in this, we know that sperms are very, very small. Even when looked under a microscope, sperms are very, very small. And so you can't really look for any defects or abnormal sperms. With this new technique, you could actually magnify sperms 7,000 times. So when you can magnify a sperm 7,000 times in the lab, you could pick up by a computerized system all the abnormalities in the sperm head, in the sperm tail, and you could identify the very sperm. Particularly patients kept on having miscarriages because of abnormal sperms, etc. This technique was superb. And many studies done by us and others have shown that people who had recurrent miscarriages or people who had repeated failures of IVF, this new technique actually really, really improved the outcomes. And you can see how that sperm is being measured. It's an entire computerized system. The head, the tail, everything is analyzed. You can see the magnification with which you can identify and study the sperm. So this was the new IMSI technique which then came in. And pregnancy rates really, really improved. And then another great breakthrough. It's a very, very famous MAC in gynecology. He's a laparoscopic surgeon called Jacques Donnet. Jacques Donnet had a patient who, unfortunately, young lady who developed Hodgkin's lymphoma advanced stage. The lady needed to undergo chemotherapy. We all know that chemotherapy would make the woman sterile. It would completely put her into menopause. So what he did was put in the laparoscope, take a small biopsy from her ovaries and freeze it, after which the woman underwent chemotherapy. Today, many, many patients recover after cancer treatment, after radiation, after chemotherapy. This lady completely recovered from a Hodgkin's lymphoma. A couple of years later, he took that little piece of ovary that he had taken and put it back into the ovarian fossa in a small surgery of about 20 minutes. Lo and behold, the lady started ovulating. She was in menopause already after chemotherapy. After the ovarian transplant of her own frozen ovary, she started ovulating and became pregnant naturally and gave birth to a baby. This was amazing. And this now, again, ovarian freezing has become quite a standardized procedure, and pre-cancer therapy, whether it's for men, whether it's for women, always recommend freezing of the gametes, because we know that any kind of cancer treatment will ruin the gametes for life. We know, all of you have seen that with fertility treatment, there's a big risk of multiple pregnancies. We don't call it a gift, we actually call it a problem when a patient has twins, triplets, quadruplets, etc. And so the focus now is shifting on having one healthy baby. Not having triplets and quadruplets, we consider that a failure of IVF. And so more and more focus on trying to find that one beautiful embryo which will give us a baby, and putting back into the woman only one embryo. Because as a rule, most of us today put back 2 embryos, or some even put back 3 embryos just to get a good pregnancy rate, and obviously as a result we have multiple pregnancies. And so very complex things started to happen. I'm just going to name a few of them just to tell you how complex the technique was. How do you select an embryo? It's a tiny little dot even under the microscope. How do you know which embryo is good? So we started doing metabolomics, that is actually study the metabolites which are excreted by the embryo to see whether this embryo is good. We started doing proteomics, study the proteins secreted by the embryo. The genomics, study the genetic structure of those embryos. Transcriptomics, and of course, morphological analysis. So many different techniques, and believe me, we have gone through most of them. We bought once upon a time the metabolomics. Unfortunately, didn't do well, so huge investment went to waste. We bought transcriptomics, didn't do well. they did find that, which is now internationally accepted as the best way to choose embryos. It's called morphological forming. You have to see the embryo, see its growth, and the beautiful embryos are the ones which are the healthiest and most likely to give you a pregnancy. And I just showed you how these embryos look. So in the embryoscope, this is how the embryos look. It's a completely non-touch technique. You take your eggs after injecting it with a sperm, put it into the incubator, do not even touch it for 2 days. It's a live camera over there. It relays to us on our phone. We can see how the embryos are developing. And there's a system by which the embryos develop. The ones which grow faster, multiply faster, are symmetrical, have number of blastomeres, are the good embryos. So you can actually select an embryo without any touching, without anything, and pick up the best embryo, and that one single embryo implanted inside will give you one good, healthy baby without multiple pregnancy risk. So, like I said, the journey of IVF, the discoveries, the new things continued. And finally, India came on the map. I don't know whether it's to our credit or to our discredit, but the world's oldest mother, 70 years old, was born in India, Raju Devi. To me, and I've gone through this personally, she just announced that we had our own 60-year-old lady whom we made pregnant and delivered, the first and the last one. We never did it again, because just because you can do something doesn't mean that you should do it. Today, I can say with confidence, we can make almost every woman pregnant. Your mother and your grandmother, we can make them pregnant. Believe me, it's not difficult. It's the same technique. Very easy. Very easy. That doesn't mean that we should do it. We can easily bring back periods of a menopausal lady, give her contraceptive pills, she'll start cycling, give her 3-4 months of hormone pills, periods will start, take an embryo, put it inside, she'll become pregnant. I mean, there's nothing to it. It's simple. But these are the problems. And even today, there are some units who continue, and there's a line outside that center in the north of India who's fighting the whole system and saying, I don't care, this woman wants a lady 70, 75, no problems, I'll make her pregnant. So, I mean, we have all these, rebels in every field. Then, of course, Leslie Brown, the world's first IVF mother, died in 2012. Surprisingly, the man who actually created history, Edwards, died immediately after. But progress continues. Progress never stops with one human being. And after that, human cloning, stem cells, so many progressive things happened. But even then, despite so many advances, some patients could not become pregnant. What do you do with a lady who's born without a uterus? You know, many girls are born with the RKH syndrome. They don't have a uterus at birth. Or if the uterus is completely damaged with tuberculosis, in our country so many women have tuberculosis. Or if there's a failure, or if there is complete and absolute absence of sperm, what do? You can't create from somewhere sperms or eggs. And so, third-party options came in. And third-party options is really what we do when a lady doesn't have eggs. Then we borrow an egg from a young donor. We take the sperms of the husband, because the husband is normal, we make a baby, and we put it back into the parent, the lady who wants to be a parent. So the egg is borrowed from a young donor. This is very, very commonplace. So if a menopausal lady wants to become pregnant, this is how she would become pregnant with a donor egg and IVF. Embryo donation is again routine. If neither the egg or the sperm is available, for whatever the reason, a ready-made embryo, which we have hundreds of them in our laboratory, in our egg bank and semen bank, we actually take a ready-made baby or an embryo and put it inside the womb of the parent. And this is like an adoption. It's an adoption, but in adoption you bring a baby home. Here we put an embryo into your womb, so it's an embryo adoption. And of course, there is the much talked about surrogacy. In surrogacy, what happens? The lady either doesn't have a womb or has a womb which is incapable of carrying a baby. And so, usually, the egg is her own, the sperm is of the husband, the baby is their own genetic baby. But because she doesn't have a uterus to carry it, the embryo is put into another woman's womb just to carry the baby and deliver the baby and hand it over to the biological parents. This is obviously very, very routine. Of course, there's a lot of controversy today because of commercialization, selling of the womb, etc., etc. And I have personally, as president, gone to Parliament and physically fought with the parliamentarians because they were ready to ban surrogacy, or they were ready to say that only your sister can carry a baby for you. And I said that will result in a lot of exploitation. They had no idea. They thought surrogacy is done only by the Shah Rukh Khans and the Karan Johars of today. They had no idea that surrogacy is done by women who are actually born without a womb, by women who've been damaged, their uterus has been damaged by tuberculosis. So I said, you first cure tuberculosis in your country. Every third woman is having tuberculosis. You solve that problem, then you ban surrogacy. So finally, we've managed to at least lift the ban on surrogacy. But foreign surrogacy. One of those wonderful old days when things were a little more liberal. We could do quite a few things within the realms of the law. And one of our little embryos came in from the US, flew into Dubai, came into India, got stuck at the customs. This little embryo was sitting in the customs and they didn't know what to do. They didn't know whether to put custom duty on that embryo or what to do. And it was many, many days and they didn't have it in their list of customable items. And this is a real story. It was in the papers with our names in it. And so we used to go to the airport because we were so scared because the liquid nitrogen would dry. So every 2 days we were going to the customs inside the office, pouring liquid nitrogen into the cryo cans, keeping that little embryo alive. And finally, after a lot of work and lot of legal issues, we managed to retrieve those embryos, put it inside an Indian surrogate, had the baby 9 months later, and gave it to these biological parents, who then flew in from USA to claim their baby. So this was what we were doing, a lot of amazing work. Like I said, surrogacy comes with a lot of legal and ethical issues because they're so women empowered today, are very, very, not wanting to rent their homes or lend their homes. Actually, it's not really commercial. To me, it's compensated surrogacy. How can anybody pay you for giving the magic of life to another couple? If you're going to carry a baby for somebody, what bigger gift can you give somebody than the gift of a baby? But, with the ethical problems, finally this had to come in. And so in 2009, uterine transplant was done. Nobody ever thought uterus will be transplanted. Yes, kidney life-saving, liver life-saving, but uterus, nobody ever thought. And then uterus was transplanted because there was this young lady who was born without a uterus. I told you, Rokitansky-Kuster-Hauser syndrome, pretty common. I see it every now and then. And so this lady, in RKH typically, they have ovaries, they have eggs, they don't have a uterus at all. And so this young lady's eggs were retrieved as in a normal IVF process. And since she didn't have a uterus, her eggs were taken out, embryos were frozen. An older lady, 60-year-old, 61-year-old, who had already finished her childbearing, her uterus was harvested, transplanted into this young lady who was born without a uterus, and lo and behold, her period started, and a few months later, her own embryos were put back into the womb. She became pregnant, and she went on to deliver in 2014 a 1.7 kg baby. The first uterine transplant baby in the world in Sweden. That was amazing. And then India's never going to be left behind, right? So India has just done its first uterine transplant last year. Of course, we yet don't have a pregnancy, but successful uterine transplant has been done in India. And believe me, it's an extremely difficult and very, very complex procedure. So much has been achieved, and there's so much more to go. So just a few, touching upon a few things which in your time or in your lifespan as doctors and practitioners will come into being. Of course, we acknowledged finally in 2010 when the Nobel Prize was given to Sir Edwards for his fantastic work in IVF. They say that in the next few years, every single embryo which is created is going to be biopsied, going to be confirmed that it's a normal embryo by next generation sequencing or CGH microarrays, so new techniques to analyze embryos, and only perfect embryos will be transplanted back. So there will be no miscarriages, no abnormal babies being born. This is in the very near future, just a couple of years away. Then came in an augment technique, again very new and very fascinating because a lot of people were not becoming pregnant with IVF. So what was being done? The ovarian biopsy was being taken, the mitochondria was extracted from there, and with the sperm, mitochondria was injected into the egg. And women who were not becoming pregnant despite multiple IVFs actually went ahead and had babies. This was augment technique. What about stem cells? Believe me, stem cells are here to stay. Stem cells are being manufactured, are being used to manufacture sperms from nothing, from skin cells, from very, very prepubescent boys who don't even have sperm, the spermatogonia taken, they're matured, and stem cells are being created. From the ovary, there is a germinal layer. You can actually pick up those and you can use those to create ovarian stem cells. So like I said, even an old lady, a lady who's born with ovarian failure, who has problems like Turner syndrome, you can actually retrieve germ cells and make eggs out of nothing. Endometrium has been regenerated, and this is actually happening. There are many, many cases reported in which a lady has complete damage of the uterine lining because of damage, because of tuberculosis, because of surgery, because of infections, and stem cells are injected inside, and the lining of the uterus starts to grow, and the patient starts menstruating, who's never menstruated before. So this is actually a reality. These are not in the future, these are in the present. There's another fantastic thing happening, and it has made it to the headlines of top magazines in the world, called the CRISPR technique. And this is again not experimental. The UK authority, which is very, very strict, has actually given the go-ahead for this CRISPR therapy, where they can actually go into the gene, into the chromosome, modify it, do genetic changes into the DNA, and modify and remove the damages and defects which are there, and actually rectify it. And so this is actually a reality. This has been given legal permission to be done. And CRISPR technique is a reality today. It's going to be routine when you guys get into practice. Every gene, every DNA, every chromosome can be edited and modified. And so we're looking to a world where there will be almost no imperfections. This came in 9th February last week. The headlines, most of you must have read it. Scientists grow human eggs to full maturity in a lab. First time, from nothing, they could create a human egg fully ready to be fertilized and made into a baby. This is an amazing breakthrough because it will help cancer patients preserve their fertility. It will help ladies who are born without ovaries and many such patients to actually have a baby. Many of you may have read this book. I read it when I was your age. Aldous Huxley, in A Brave New World, had described in 1932, he had described IVF as science fiction. IVF is now a reality, as you can all see. He had also described what he called as exogenesis, namely the development of the conceptus in vitro to the point of viability. In other words, growing a baby outside the womb to term. You can see these images, these are real images. Worldwide, sheep, lambs have been grown to full term in an incubator. If a sheep can be grown to full term in an incubator, how far behind are human beings? Not too far behind at all. I think we're just waiting for licenses and legal issues. Once that right is given, babies who are born maybe extremely premature, maybe IVF babies, will be grown in an incubator. Even women who don't have a home will be able to have what is called exogenesis. Of course, with all these techniques, very important to focus on ethics and legalities and legislation. And we have a huge problem in India. We don't have a law. There is no law of IVF in our country. We've been fighting it for the last 10 years. We have created guidelines and laws. The parliament obviously doesn't have time to pass things like IVF laws in this country. And so there's mad proliferation of centers, there's no standardization, there are no ethics, there is no cost standardization, all kinds of full-page ads are coming, like a supermarket, prices slashed, and 1/4 the price you get IVF. So it's become really something which is not very, very pleasant. But that's because there is really no law in this field. And so even today, people who have fertility problems face a lot of issues. It's difficult to get information. The treatments are expensive. There's no emotional support. We don't have support groups for infertility. Where do they go? In a small town, there's not that much services available. In India, we don't accept same-sex marriages, so gay couples cannot have children. People who are HIV positive, great difficulty in actually accessing services. And so young cancer patients, nobody is advising them. You go to a Tata hospital, thousands of young patients suffering from cancer, nobody has the time to tell them that you can preserve your fertility. Unfortunately, what they could have saved their gametes is not being done. So we have even today a lot of stigma. People are still hiding the fact that they had a test tube baby. Every day patients tell me, doctor, paper pe mat likhna, IVF kiya hai, my mother-in-law will find out. Don't say we did this, because it is still a stigma despite so many progresses that have happened. So all I can say is advances in assisted reproductive technology is really one of the greatest medical successes of this century. Of course, there's a long way to go. We spoke about our problems, we spoke about cost factors, a lot of progress needs to be made in many, many fronts. But it has been an absolutely amazing journey from the first baby in 1978 to today, when everything possible is being done in the lab. Of course, we've done our contribution. We've had hundreds of conferences. When Vicky Donor was a very popular movie, we had called Ayushman Khurrana to our event to actually talk about how he felt about being Vicky Donor and to actually dispel the myths about semen donation. And such way, every year we have lots and lots of events, live demonstrations, workshops, training programs, because we want everyone to come into this amazing new field, an amazingly progressive field called assisted reproductive technologies. Success, I believe, is really the good fortune that comes from aspiration, desperation, perspiration, and inspiration. Every single IVF patient who comes to us, this is what we put into it. And at the end of the day, when we get that beautiful baby, I can't even tell you the feeling that we have. Everywhere I go, I was at the airport 2 days ago, patient, baby, the baby in the plane, poor baby wrote a little thing, thank you doctor for bringing me into this world, and a little sheet of paper, and she gave it to me. Everywhere we go, you have little children coming and saying, doctor, thank you for bringing me to this world. Patients come and touch our feet. It is the most beautiful feeling ever to give this gift of life to patients. So I feel blessed that I've been chosen to make this small contribution.